Today is to welcome you to Hofstra on behalf of President Susan Poser and Provost Charlie Reardon, people I work for, people who sign my paychecks. And of course, we know all deference must be due to that. Really related to what's happening in this room is that Hofstra and its new leadership, its new strategic plan is determined to devote more of its research, more of its resources to the communities around campus. Now, we do spend a lot of time developing courses and producing terrific students who go on to become leaders, but there's a realization that we must do more beyond our campus fence. And partnerships with AAIRE, which if it didn't exist, somebody would have to invent it, but Farrah already did. Partnerships like this are at the core of what we hope to do and what we will continue to do.
The past 2 years has been groundbreaking. You'll see in front of you our impact report, which Laura and TJ will be talking about. But this is what AIR is about. The Asian community on Long Island is one of the fastest growing communities on the island. It is the Asian community in America is the fastest growing community. We have exponentially grown 150% over the past 10 years. We're about 13% of the population in Nassau County, 7% of the population in Suffolk County. If you look at the school districts and the population in those districts, some of the schools like Jericho and some other of these schools, their first grade, second grade, kindergarten, their classes are 90% Asian American. So this is a population growing the fastest, yet there's no foundation for this community. There's no organizations that have advocacy for these communities as a united front, and that's what AIR is about. We are here to present data, numbers, to tell the story of our communities so that we can create coalitions, be unified, and then advocate for policy changes. And the research that we've done today, or for the past 2 years that we're going to be presenting the findings today, that research is on language access. And I don't think there's ever been a study on Long Island focusing on the API community in terms of language access. And the numbers that we found are disturbing, and they're going to be instrumental in creating change for our communities. Because no one is going to be able to sweep under the rug the things in our communities anymore. We will be the ones advocating for our communities. We'll be working with other organizations to work together and unite. And that's the most important thing. Today, at any one of our AIR events, if you look, there's so much diversity. Because we have to work in unison together. Work with other communities, work with different Asian communities, work with people who are like-minded like us that want to see Nassau County and Suffolk County be inclusive and diverse. So that is our main focus for AIR. I would like Rizwan Qureshi from HAB Bank to just say a couple of words about the support that he's given us and how he's been instrumental to AIR. Because his time is valuable, and I can see him looking at me saying that he has to go.
It's my honor to say a few words about HAB Bank, AIR, and why do we support Farrah's brainchild. It's all about community. As a New York City-based community bank, which has been around for over 40 years, we have been an integral part of our communities around our branches with a focus on Asian American community. Our community-centric approach aligns perfectly well with AIR. We have supported AIR since its inception, and we are so proud of it. Over the past decade, Long Island has seen a significant rise in its Asian American population, and AIR is the first organization to address the unique challenges faced by this growing community. The research that we will hear about today makes it clear language barriers are not just personal hurdles, but community-wide issues that affect civic engagement, access to services, and overall well-being. We want to tell our story, but when you have data to back it up, it carries certain weight, and people tend to get it. AIR has done a lot of data crunching over the years, and that helps us tell the complete story of Asian American community based on facts and context. It highlights impediments for the community and possible solution for the policymakers. We must work together to address these barriers through language support, community outreach, and collaboration. HAB Bank will continue to do its part has allowed AIR to stand outside of Hicksville branch to conduct surveys and all that. Whatever you want, Farah, you'll have it. That is my commitment. That is our commitment, because again, we are a community bank and we want to be engaged. We have been engaged with lots of community organizations and you're part of it. So let's work together, serving our respective communities so we get empowered and be a vibrant part of American fabric. Thank you for listening to me. This is a boring speech. Have a good day.
So now we're going to turn it over to a couple of our board members who will be talking about AIR's impact since its inception in 2022. I want to turn it over to former County Executive Laura Curran and TJ Bola, who will be talking about our all the different works that we've been doing for since the inception.
So the AIR stands for Asian American Institute for Research and Engagement. And those last two words, research and engagement, are really important and two very big parts of the mission. And so I just, you have the sheet in front of you, so I'm not going to read everything. I just want to give you some of the highlights, if you don't feel like reading it or if you leave it here for whatever reason. So it's the nitty-gritty, the facts, it's data-driven, facts and figures, and it's impressive when you think about all the work that Farah and her team has done over the past just 2.5 years. This started in early 2022. It includes the work I'm talking about now, helping secure $500,000 in funding for Asian nonprofits, and if anyone here is in the nonprofit community, you know how difficult it is to raise money, so that's quite impressive. And these are groups, nonprofit groups, that do need a lot of help, especially, as Farah noted, the population is growing faster than any other population here on Long Island. It's also a go-to trusted source for reporters, and I know we have some reporters in the room. AIR has been quoted more than 50 times in various media outlets. Yes, Newsday and Channel 12 here on Long Island, but also papers like the New York Times. She's in people's Rolodex, if they even have Rolodexes anymore, but in their contacts, reporters' contacts, and that's, as this population grows, there will be more press, there will be more stories, and more of a desire for experts to speak on the subject. So that's a really important way to get the name out as well. There's also, as part of lobbying, a lot of meeting with elected officials and that sort of thing. Farah can talk about that more, but I know it's dozens and dozens of officials from, village government to Congress have been engaged by AIR. Education is a big piece of it. AIR has educated more than 800 teachers statewide on cultural understanding of our growing Asian population and talking about difficult issues like Islamophobia and anti-Asian hate. And I think we're seeing some of the benefits of that, especially in this difficult time right now. A big topic is language access, and the education with the teachers is also a big part of that, is making sure that teachers know how to handle language barriers, what resources are available for their students so that they can succeed. On a fun note, AIR has helped dozens of young people get internships, get that first foot in the door, so that's incredibly valuable as well. Farah and AIR is extending, in terms of engagement, a lot of the good work we did in county government, and that's helping real people navigate a Byzantine government here on Long Island, between towns and villages. I mean, if you were born and grew up on Long Island, it's very confusing. So you can imagine if you're a newer arrival, may have some language issues, maybe some trust issues when it comes to government. That's a really important function that AIR serves as well. And I know Farah really well. If she gets a phone call, somebody has a problem, she'll do whatever she can to help them. She'll pull whatever strings she needs to do to help get people the services that they deserve and that they have every right to. So that is pretty much what my part of the talk. You can look for all of the information, but my point is AIR is very open. We talk about the Asian community here on Long Island and in the country. I mean, it's incredibly diverse. So many backgrounds. You can't lump Asians, as I look around the room, I see that, into one category. But Farah and the approach of AIR is to be very open-minded, to be very warm and welcoming, to do the research, to get the data, the surveys, etc., but also to engage and to help people where they are. And so I want to thank all of you for being here and for supporting this mission. If you find this valuable and helpful, I would also ask that you check the QR code. You can donate any amount that you would like. It's incredibly helpful, and she runs a great nonprofit. I know it's not easy, and I'm just so proud of AIR and the work that FARA does.
Indian population especially is one of the least studied populations in psychology. Asian, obviously grouped as a whole, is even less studied. But by focusing on evidence-based research, we can understand the unique challenges we face. With that said, let's take a moment to discuss the annual impact of our research initiatives. First, AIR has facilitated over 100 individual interviews with members of the Asian community to better understand their concerns. We have conducted both national and local studies on anti-Asian hate. Additionally, they've held over 20 focus groups to foster dialogue and gather in-depth insights to the AAPI community. Moreover, there's been a study on Islamophobia in Long Island classrooms, addressing the widespread discrimination faced by Muslim teens. This research is critical for creating inclusive and supportive educational environments. And we are proud to partner with the accredited nonpartisan institution, the Center of Suburban Studies at Hofstra University. And finally, we're leading a 2-year study on language access for the AAPI community in Long Island. This research aims to gather crucial insights that will help dismantle language barriers.
Now we're going to be moving on to why everybody is here today, about the findings of our language access project. Portion of the findings is about language barriers, and it's about the focus groups that we've worked on. For this portion, we're going to have Deborah from the Hofstra University and Kashmira from Team AIR and also from Hofstra University present on this portion.
Urban sustainability, equity, and economic development through research, education, and outreach. So you can see how we're a very nice pairing here with AIR. In this presentation, I'll be reviewing the goals, the methodology, and the results of our language barrier focus groups. So as I mentioned, the National Center for Suburban Studies conducts research, so we're very fortunate to have AIR as a partner to try and learn and address some of the barriers facing Asian American communities here on Long Island. Okay. So our goals for the focus groups were to enhance efforts for a more inclusive and accessible Long Island for all of Asian Americans, to identify the types of obstacles most prevalent among Asian Americans on Long Island. And we'll talk some more about the methodology. Each focus group was given demographic questions and background information at the start of each focus group. The focus groups are semi-structured, meaning we had some topics prepared in advance, but we also left some open space for community-driven thoughts and ideas. Each focus group lasted about an hour, and we provided refreshments, because that's very important to get people to come. And each group provided us with very valuable insights on the survey, which you'll be hearing about shortly. All right. So these were our topics: participant demographics, language barriers, discrimination, and the future of language access. In total, there were 3 focus groups. The first was here at Hofstra, and it was with some actually faces I recognize, so these stakeholders in both the East Asian and South Asian communities. It was about 15 participants, and it was conducted in English. The second focus group was in Hicksville, had about 20 participants, and focused on the South Asian community. This was conducted in Hindi, Urdu, and English. And the last focus group had about 10 participants in New Hyde Park, 12 participants rather, in New Hyde Park from the East Asian community. That was in English and Mandarin. And now I'm going to pass it off to Kashmira, who, as you heard, is graduating in December and studied politics and policy and international affairs. So she'll be looking for a job soon. All right, thank you. Here you go, Kashmira.
Deb, and good morning, everyone. It's really such a joy to see so many people here. Thank you for being here this morning, for taking the time to be here. It really means a lot. So without further ado, a majority of the qualitative semi-structured interviews in each of the 3 focus groups, as Demi mentioned, focused on language barriers, the respondents' experiences with them, and most importantly, how they think they should be overcome. And since it was this topic of language barriers, which constituted over half of our conversations, it was really their insights that led us to develop the very first Asian language access survey that was then distributed to the entire API population, which Claudia and Professor Neat will talk about in the next presentation. And so, without further ado, here were the results from each of those 3 focus groups. So the first focus group really focused on the South and East Asian community stakeholders, and through these, they really found that, it was really the legal services, which were also those that were also in need of the most translation services. So not only were these populations in the most need for assistance, but they also needed the most translation. But from a provision perspective, it was not only costly to provide translation services continuously, but it was also difficult to find attorneys at that moment that spoke that exact language. And so many of the community stakeholders that were in these focus groups also reported that the language line or AI assisted tools that may be used to connect with the person in that moment may not always be the most accurate or reflective as much as a culturally competent person that may be able to convey their thoughts and emotions as accurately as the person would like. And so this led to a lot of constituent difficulty in filling out government forms and also understanding the election process, as some processes here may not always match up accurately to those in their native countries. So the second focus group really focused on newly arrived members of the South Asian population at Hicksville High School, and for this we really have to thank Sunitha Matrick as well for helping to make this group possible. And so from that focus group, we really did learn that yes, some of them were able to contact 911 in cases of emergency, but this was only in cases of emergency. When it came to non-emergency cases, they faced significant hesitancy to ask for any kind of assistance regarding, and just based on the fact that their English they felt was not as good as it could be. And so this, you could see, provides a very clear detriment to the APN population if they are ever to seek assistance through a government agency. They would not have that capability because they fear that their English is not good enough. And so it's really the younger generations that were then sharing how they would translate for the older generations, particularly Hindi, Punjabi, Urdu, and English with a combination of another language were often the means and the methods by which they would be able to translanguage and then communicate with the older populations. This third focus group was East Asian seniors at the Joy Food Community Center in New Hyde Park, reported kind of the opposite of focus group 2, whereas they would not even call 911 in the case of an emergency, whereas the South Asian population at least would. They would not, just due to their language access barrier. Once again, they would rely on their children or younger relatives to help them translate information, be it at schools, doctor's appointments, government forms, whatever it may be, just to help them understand the information. And so it was through these younger children that they were also able to then learn about the voting process and elections. And here we are, it is great to say that many of the East Asian members were also volunteering at elections, and so they were able to learn that way as well. And most of the seniors, as we'll see a little later on, were actually using their phones to translate these surveys and the interview questions in order to understand them and respond adequately. And so, without needless to say, this really does show the impact of discrimination between all of the groups. So each of the 3 focus groups, regardless of whether they were community stakeholders or East Asian members of the senior population or just newly arrived members, all 3 reflected high rates of discrimination. So the community stakeholders shared that it was very prevalent when it came to their language access, and so they requested that it be included on the survey for the larger API population. Likewise, the newly arrived group said that they shared high degrees of discrimination when they were speaking English, in stores. And the third group presented the most profound results, where the language access or their language barrier caused a degree of fear to the point where they could not, or they would actually fear using the subway or any form of public transport because they would fear any kind of discrimination or hate crime or hate act on the way there. So this prevented them from seeing family or seeing relatives as they would before COVID. And so this brings us to the 3 policy recommendations from each of the 3 focus groups. And this really shows us the impact of the focus groups because it shows us what these communities are really, really longing and would like to see in order to improve. So the first focus group of community stakeholders shared how they need to feel safe. They need to have these safe spaces where they can grow and have conversations and talk and bond and form connections, as we all do, as we all are humans. This was focus group 1. So they shared the need for safe spaces and creating those spaces. The respondents in focus group 2, the newly arrived members of the South Asian community, shared that they need to have some kind of training or assimilation process that could help newly arrived families in the first few weeks of school, because they had a lot of difficulty with understanding the current processes and the way that the school systems here work as compared to their native country. So even if it were a program that lasted for two weeks to 3 months of school, that could be of assistance to them. And so many of them are also taking classes to learn or improve their English and taking the required proficiency tests that come with it. So that's really one avenue through which they said these training programs or assimilation programs can really, really benefit the newly arrived populations. And finally, the third group of seniors really just shared the need for Asian representation in government jobs and in schools. And so these are some photos from focus group 1. You can see we have East and South Asian community leaders. This was from focus group 2, South Asian members, and some members of the third focus group, the East Asian population. So thank you all so much, and with that, that's the focus group.
And Kashmira for that insightful discussion about our focus groups. So again, the reason why we conducted these focus groups was because we were putting a survey out in field for the community. So before we wanted that survey to go out in field, we wanted to check with our stakeholders, with the population, small populations, to make sure that those questions were good to send out. And what we found was when we were doing these focus groups, that we ended up changing the questions a lot compared to what we had started out with because of the recommendations of the focus groups. And another thing I wanted to note about these focus groups is that we had created a safe space for these communities. We were trusted messengers and ambassadors into the community, so they were able to meet with us and they felt comfortable letting us know about how they felt. And one of the things we also noticed was there was a local newspaper that was doing an article on language barriers, and they asked some of these residents that, hey, would you speak with us? And no one wanted to speak with the newspaper. No one even wanted to speak anonymously with the newspaper. So really, in these communities, it is extremely important to be trusted. And I think that's one of the main things about AIR is that we are a trusted ambassador and a messenger for these communities. So they feel safe with us, and they're able to explain what barriers and what discrimination they felt. We do have video testimonials with a lot of these people who are able to go on, and the stories were sometimes heartbreaking. So these focus groups are extremely important. On our program right now, we have a wonderful honoree, Betty, but we're just gonna finish up the language access portion because we have a few newspapers here and they wanna just hear the rest of our findings, and then we're gonna go on to honoring Betty and to continuing the program. So I just wanna switch the program a little bit from what's on the actual program. So we're gonna go into just the findings of the survey. So you heard about the focus groups and what people thought of the focus groups. Now that created a survey, and that survey was out in field. And now Dr. Need and Claudia, and I think Larry also is going to be presenting, and myself, on the findings of these surveys.
I'm Academic Director of the National Center for Suburban Studies. I'm also the Chair of the Sociology Department here at Hofstra. I worked on the survey component of this project, along with a team that included Farah from AIR, as well as my colleagues Larry Levy and Deb Tenerello from NCSS, as well as Dr. Albrutis from the School of Health Professions here at Hofstra. The survey really tried to build upon the findings of the focus groups that you just heard described, right? So the focus groups, they're small groups with community organizations they already have a relationship with. The survey component of the research was an attempt to kind of broaden out, to ask some of the questions that had surfaced in the focus groups to a much broader group of Asian American respondents here on the island. And so the structure of the survey was, first we asked a number of questions about particular language barriers to identify the language needs that were most important. And then we asked a series of demographic questions in an attempt to distinguish between, to find which groups experience the greatest barriers that were greater than others. The language barriers section of the survey included several questions. First, we asked respondents what languages were spoken at home. We asked about whether they had difficulty reading, writing, speaking, or listening in English. And this is, I want to flag this because this is a category that's going to come up several times in the following slides. Of the folks that we asked of our respondents, about 60% of them said that they had some problem reading, writing, speaking, or listening in English. After we corrected that figure for kind of an overrepresentation of folks who had been born outside the United States, the figure was closer to 50, right? So about half of our respondents had some trouble with one of these types of communication. About a quarter of our respondents did not have problems communicating personally, but had someone in their family who had issues communicating in English. And then the final quarter had neither personal problems nor did their family members have problems communicating. We then asked those who had said that either they or their family had problems communicating, whether they had difficulty accessing services such as healthcare, police and fire, education, government services, and so on. Some of the same problems that, again, had emerged from our discussions in the focus group. We asked whether the respondents or their family members had previously used an interpreter to get a sense of the potential gap between the need for interpretation services and the actual use of those services. We asked whether voting was accessible, whether language barriers had prevented respondents from understanding elections and participating in the electoral process. And then finally, we asked about the experience of discrimination, which, as Kashmir just said, had emerged as a priority in those focus groups, had been identified as a key problem. In terms of the demographic questions, we asked about age, gender, ethnic background, year of arrival in the United States, citizenship, level of education, employment status, business ownership, and place of residence. And for anyone to respond to the survey, there were a couple of basic requirements. They had to be 18 years old, they had to be a Long Island resident, they had to identify as Asian American, and they had to agree to the consent form that was attached to the survey. The respondents were informed that their participation was voluntary and anonymous. We distributed the survey in two ways. First, we sent out a link to an online Qualtrics survey, but we also, working with AIR, distributed the survey in physical and printed copies, which was especially important for populations that had difficulty reading and writing in English. And those printed versions were administered with the assistance of interpreters. So I'm going to turn the mic to Claudia Chung, who's going to talk to us a little bit about survey methods.
Thank you very much. Good morning. My name is Claudia Chen. I'm an undergraduate student at New York University, and I'm very grateful to, over the summer, have had the opportunity to assist AIR in their research into language access and language barriers. And so AIR embarked on 2 separate campaigns to administer our survey, mirroring the digital and physical formats that Dr. Need had just described. So I would like to start with the digital campaigns, for which we had the support of our wonderful community leaders and stakeholders. Many of you are in the room with us right now. So we started by identifying and reaching out to the community leaders representing a variety of backgrounds and organizations, asking that they share our survey widely to their groups to help us gather more respondents. So many in the room with us, thank you so much for your continued support of AIR. So AIR prepared an email with our Qualtrics link and a poster with the details and qualifications necessary to respond to the survey, as well as a QR code to access the survey more easily. So we asked that these community leaders would share it with their community members, with their family, with their peers. And so after that, we had AIR interns embark on a calling and texting campaign to follow up with that. And so this also helped to further spread the reach of the survey to friends and family as well. So here's a copy of that poster that we shared. And so I just wanted to say thank you again for all of your support and diligence to our community leaders, and through your work we were able to get many more responses, and that's been so important to having a very good generalizable result from our survey. The second campaign was to personally administer the physical copies of the survey in a variety of locations. We have community events and food festivals, senior centers, places of worship, and a bunch of Asian supermarkets as well. And like we said, AIR's interpreters aided in the survey process, and as well as that, we noticed during the survey process that a lot of individuals were using their phones to translate, which also just shows as a reminder, a very clear reminder, how necessary it is for language access and people's reliance on their phones when in the lack of interpreters. And I also wanted to recognize a few organizations specifically who helped to administer our survey by welcoming AIR into their communities. So thank you very much to the Turkish Cultural Association, India Voice, and Joy Food Club. Thank you very much. And so here are a few photos from the process, and thank you for everyone who took our survey. Your experiences that you were able to share with us in the survey have really contributed to the greater picture of language access on Long Island, and so thank you very much. Thank you for supporting AIR. And now Dr. Need will get back into the findings of our survey specifically.
Okay.
I just have a question. How were the respondents chosen? Was it a random picking, or and how do you account for people who might have a language barrier that do not necessarily come out to these events? Is there an accommodation built into this? And how many total people, amount of the population that was surveyed? What was the total count?
So I'll speak about the total count in a moment. In terms of the outreach, I don't know if Farah, if you want to say anything more about that, not to put you on the spot.
Part of the survey was we did definitely have interpreters helping us in the in-person campaign for when we were personally administering the physical survey, and also built into the digital survey there was a portion where if someone indicated that they had difficulty with communicating in English, there was also the option to input a phone number where they could call and reach out to someone in our survey to administer the survey in their native language. So that was also an option.
We also took a lot of time to make sure that the sample was balanced. We not only had a relatively large number, which Chris is going to talk about, but I remember there was one point where we said, oh my God, one particular group was really underrepresented. We could have let it go, but we decided that this had to be, the expression is bulletproof. And we spent a lot of time making sure that that particular group made sure that the sample of the dozens of Asian groups was truly representative. So this is a survey that I think Chris is an academic, I as an academic and former journalist can feel pretty confident that it really represents what's going on out there. But that's a great question. Thank you. Important question.
Okay, so the survey was out in the field for about 7 weeks, between August 4th and September 26th of this year. We received 475 total responses. About slightly less than, slightly more than a quarter of them were incomplete or lacked key demographic data that we needed for analysis. 64% of the surveys were distributed in person. In terms of the demographic breakdown of the respondents, we have the majority of the respondents were female, somewhat over 55% of them, and the respondents were relatively well distributed over the different age ranges, although the number of respondents in the 45 to 54 group was disproportionately higher. A vast majority of the respondents had been born outside of the United States, and the year of arrival for that population was fairly spread through the recent decades. About half of those born outside the United States had arrived either in the 1990s or 2000s. Some had arrived earlier, some had arrived later. We also examined the educational breakdown, the highest level of education attained. As previous studies have shown, Asian Americans on Long Island have high degrees of educational attainment. So about 37% had a bachelor's degree, 35% had a postgraduate degree, and about 25% had either some college or high school diploma or less. So given this demographic profile, we did weight the data, right? And weighting is a process when you do a survey and you get findings, for example, our findings for female and male, those two numbers should be closer to 50-50, right, if we want them to be represented. So weighting is a process by which, when you're doing a survey, you correct for some of those imbalances. As Larry just said, the goal when you're deploying a survey is when you're getting it out there, you're trying to build it as representative to the sample as you can. This is a further adjustment that tries to make the findings even more accurate. Those reporting the language difficulty, again, the raw numbers of respondents who said they had some trouble communicating in English was about just under 60%. When we weighted the data, that number fell to 50%. And the reason why is that the number of folks born outside of the US was overrepresented. So about 50% of respondents had personal problems communicating in English. Another 26% had a family member living on Long Island who had problems communicating in English, and then the remaining 24% had neither individual or personal problems. We want to examine specifically the group that had some sort of language difficulty. And again, the definition here is either reading, writing, speaking, or listening in English. And among those who did have an individual language difficulty, we found very high rates of language barriers in a number of different domains. And again, these areas were specified through that focus group process. They emerged through those discussions. Some of the most serious barriers existed in the field of healthcare. So over half of respondents with some sort of difficulty communicating in English face barriers in emergency healthcare, accessing health insurance, accessing police and fire insurance, fire services, and accessing legal assistance. Non-emergency health and school problems accessing school education and child care were not far behind at just over 40%. The figures were lower for shopping and recreation, which shows that overall respondents had an easier time of accessing those services. And in some ways, as someone, when you're sending out a survey, sometimes lower numbers are reassuring because it shows you that someone's not just looking, yes, problem. Like, people were actually looking at each question, each item, and thinking about whether they faced those barriers. I would also note that one of the other low figures, areas where we saw a lower percentage of respondents facing barriers was public transportation, which was just under 20%. We think, though, that this might be an underestimate. One mistake that I think we did make in our survey is that we should have asked, since we were asking about public transportation, we also should have asked residents about whether they had access to a car and whether they commuted on public transportation. If you go into the census data, you'll see that only 15% of Asian Americans on Long Island report commuting by public transportation. So the fact that 19% of respondents who have a problem communicating in English said that public transportation, they face barriers on public transportation, is actually quite troubling. And is, again, kind of probably the headline number, 19%, understates the magnitude of the problem. We also asked about those whose families had difficulty communicating in English, and there too we found that respondents said that their family members also faced language barriers. And again, the pattern was relatively similar to other respondents. Non-emergency care was somewhat higher, perhaps reflecting that when healthcare is planned, more people, and this kind of goes back to our findings from the focus group, people who have difficulty communicating English might ask a family member to accompany them on a visit to a doctor, which is probably why this number is somewhat higher. But even in the other areas that we tested, many of those areas, emergency health care, health insurance, education, childcare, shopping, and legal assistance, all were about 40%, right? So 40% of those whose family members have trouble communicating in English identified those areas as barriers. So just to kind of summarize or kind of reiterate some of the key findings here, the data reveal that emergency healthcare, police, fire services, and legal assistance are three of the most impacted areas, with over half of respondents with language difficulties reporting language-based obstacles accessing those services. That's followed by schools, education, and childcare, where 43% of respondents reported difficulty accessing those services. The challenges related to shopping and recreation were somewhat lower, as was public transportation, with the caveat that I just mentioned. We then asked about use of interpretation, because we want to get a sense of the gap between the areas of need and the areas where the need is actually being met. This first slide is kind of a summary slide of what we've just been discussing that combines the groups the percent of respondents that personally faced a barrier in those areas, shown in the yellow bars, with the percentage of folks who reported that their family faced that barrier in the red bars above. And now, I know this is, I'll walk you through the format. So these stacked bars on this slide are the red bars on the second slide. So the red bars, again, are showing whether if you were an individual or if you had a family member who faced barriers in those areas, you measure the percentage that faced those barriers. And then the yellow bars next to them show the percentage of respondents who said that either they or their family member had used interpreters to try to access that service. And you can see the gap is quite sizable, right? In most of these areas, there's at least a 25% gap between the percentage of folks who are responding that either they or their family member faced a barrier in that area, and the percentage of folks who said that they've used interpretation. So there's a very clear unmet need. Again, our findings show a discrepancy between where residents need help and how often they're receiving it. And so just to return back to the point that was mentioned earlier that emerged from the focus groups, the language lines do exist, but they're not equivalent to the assistance that individuals get from in-person interpreters, especially culturally competent ones. We asked respondents about their experiences with discrimination. And here we found that the ability to communicate in English, you can see here that the yellow bars show the percentage of respondents who's, with language difficulties who said that they sometimes experienced discrimination. And then the red bars show the percentage of respondents who say they always experience discrimination. And you can see that the experiences of discrimination based upon ability to communicate in accent are almost as severe as those faced due to race and ethnicity. We asked about voting and whether language barriers presented a problem for individuals or their family members as they tried to vote. And here the numbers were striking. As Laura Kern already mentioned, the government, the structure of government on Long Island and in New York is very complex, even for someone who doesn't have language barriers. And when you add language barriers to that, a very high percentage of respondents say that they are unable to fully participate in the political life of the region. So here we see that the bars shown on this chart. The bar at the left is all Asian respondents. The orange ones are the folks experiencing who have difficulty with communication, and then the brown bars are those who do not have difficulty communicating in English. And you can see, I'll just really draw your attention to the middle bar, the orange bar, the folks who do have difficulty with communication. We see that 90% of them had their language difficulties had affected their ability to vote, right? Of those whose family members, who reported that their family members faced obstacles, about half reported that it affected their family members' ability to vote. The last two sets of bars relate to the distribution of campaign materials and whether respondents are more likely to vote for a candidate who does provide those materials in their native language. And you can see here that whether a respondent personally has a difficulty with the English language or not, there's still broad support. Many respondents feel that providing campaign materials in the native language is very important, and a very high percentage of all respondents, whether they have problems or not, say that the provision of materials in their native language makes them more likely to vote for a political candidate. Finally, we asked about ethnic media and what sources respondents rely upon when they're trying to, learn about the news, learn about voting, and we see for respondents with personal difficulty communicating, a large majority rely upon ethnic media. So the largest wedge that you see at the left shows that 59% of respondents with communication problems rely exclusively on ethnic media. The second largest wedge, the 33%, are the folks with communication problems who rely both on ethnic media and mainstream media together, right? Even among those Asian respondents who do not report difficulty with the English language, we still have a very large percentage, 50%, who rely upon ethnic media at least sometimes for their information. So again, just to summarize, we have a large percentage of Asian respondents, 52%, who reported that their ability to vote was directly affected by language barriers. An additional 19% did not face a personal barrier, but reported that language barriers inhibited the family members' understanding of elections and the voting process. And in terms of support for having materials in native languages, an overwhelming 82% stated they were more likely to support candidates who provided those campaign materials, and 79% of respondents use ethnic media to learn about elections whether in conjunction with mainstream media or not. Okay, and now I'll hand the mic back to Farah Moswala for a discussion of what this means for policy moving forward.
Thank you. These surveys were painstaking. So the volunteers and the staff at AIR, our board members, community leaders, the amount of work that was put into going to these different locations and administering these surveys, it was extremely painstaking to sit there and getting people to fill them out, to helping them fill them out, to translate the surveys. So this took a lot of work from all of our team. So further action. What is the point of all this? Why do we do these surveys? Why do we have these focus groups? Why is this important for our communities? It's here to tell our stories so we can advocate for our communities. So these are some of the recommendations that the team at AIR, Hofstra University, and our focus groups and stakeholders came up with. Many government and healthcare organizations lack sufficient language infrastructure. We need culturally competent staff to assist these diverse populations. They need to be confident in the use of the interpretation services provided. So this means, language line is great, but we noticed when people were speaking in these focus groups that they weren't comfortable with language line. They didn't want to speak to someone on the phone. They wanted a staff member, someone who speaks their language, someone who understands them, someone who is aware of the cultural nuances within these communities. Creating a pipeline for diversity in the public sector. That is extremely important, and that's one of the things that even AIR and different organizations focus on, is just even with our interns and our staff, we try to create pipelines for them to move up in the communities, into government, into policy-making jobs, into the nonprofit sector. I think Kashmira's mom is here today. Kashmira's major was not public policy. It was not anything to do with that. She had the typical, I think, South Asian or East Asian major, computer science, or you send a doctor or engineer. But because of AIR, she switched her major. And that's why I think we're pushing for her to get a good job so we can tell her mom, hey, it was a good switch over. But we need to have that pipeline for diversity in the public sector, whether it's in government, whether it's elected officials, whether it's in our school districts. We need to have in-language materials such as government forms and legal assistance in our languages. We need them in Mandarin, we need them in Korean, we need them in Urdu, we need them in Hindi. These are the 4 main languages here for Long Island. Even when we were getting the voter registration forms today, we were just online looking, and I know they have them in different languages, but online we were only able to see Spanish and English. So when we were printing them out, we were only able to print out the English ones today. We need culturally competent competency and professional development workshops, and that's where AIR comes in. We provide these workshops to school districts, we provide them to nonprofit spaces, we provide them to corporate spaces. Those workshops are extremely important because they help people who might not understand the cultural nuances within our communities. So we need to have more of those workshops. We need more Asian outreach on the importance of voting in America. We need voting rights, voting protection. We need to understand the types of elections. We need to have ethnic outreach from our candidates who are running for office. They need to reach out to our ethnic media, because you saw from the numbers today, they're staggering, that Asians use ethnic media. And a lot of this ethnic media, when we were talking with the focus groups, and we know from many of the people here, they use WhatsApp and WeChat, and they use the digital form of this ethnic media that's put on these channels and these social media, these chats, and that's how they get their information. And I'm so grateful that today we have 4 different ethnic medias covering us. We have Urdu News, Urdu Times, we have World Journal, we have Just Punjabi. So we have ethnic media even covering this event, showing the importance of ethnic media to our communities. So those are our policy policy initiatives. Larry, you're looking, do you need to?
I want to add something. I wasn't planning on, there's no slide for this. I think 17 years ago I wrote a magazine article when the Asian community was just beginning to show its statistical and actual presence on Long Island. And I interviewed the superintendent of the Herrick School District, which at that time was the first majority Asian school district in any suburb that I could find. Chris probably could find one that I would miss. But, and I asked him, I said, well, what has this meant? And he had been there for a very long time, for the operation of the school district, and particularly dealing with the families. And he said, well, that's a good question. He said, it used to be that our worry about the PTA was that they would be too aggressive. The parents would want to intrude too much in things that their parents, yeah, but they really aren't educators, they don't know. He says, our biggest problem now is the reticence of the Asian parents to get involved. The feeling that they aren't entitled to, that they will be ignored, even marginalized, and that's something that he had to work on. And what I took away from that and what stayed with me is that we have a lot of, somebody has to do this, somebody has to do that, but in the end, the government agencies, the businesses, the other organizations that will be able to effectuate this will only do it if they hear from you. If they hear from you in emails and phone calls, and this may sound like a duh, but the reality is that political people, even those with the best of intentions, the biggest hearts, and the most talented at getting things done have to prioritize, and they will prioritize first from the people they hear from. You cannot sit back. You are entitled, you are taxpayers, you are parents, you are business operators, you are entitled to the full measure of services across the spectrum, from life-saving emergency down to just being able to get a loan processed faster without feeling somebody is discriminating against you because of your accent, much less putting up actual language barriers. So what I'm saying here is not to kind of blame or shame the victim, but if the people in this room who showed the interest to come out on a morning like this, even with crepes, even if there weren't crepes, need to step up and start making your voice heard and holding people accountable. And if necessary, take the bull by the horns, as we say, as Farah did, when there was no organization, there was nobody for reporters to go to for that quote about the broader Asian community. And Farah decided to do that. And we tried to do this at the Center for Suburban Studies as well. So thank you for being here. We hope you absorb this. It's all important. It must be done. But it's not going to happen unless you make it happen directly and indirectly. I just thought I wanted to get that.
Thank you, Larry. Thank you. There are a few questions.
Is the data that's displayed available in written form somewhere? Like, do we have? Because I don't see it in the.
Yes. So the data will be available on our website and via email. You can just it's info@asianamericaninstitute.org. And if you just email us, we can send it to you. Also by next week, the end of next week, we should have an official report coming out that will be on our website. And again, you can access it on the website or you can email us and we'll get that report out to you. Awesome.
I just want to focus on two other big areas that showed up as problems. The first is accessing healthcare, right? So the big networks on Long Island, Northwell, Mount Sinai, etc. Have there been any initiatives with them to make sure that there are language interpreters available? And also there's HIPAA. How do we overcome HIPAA issues? So let me lay out the question. So those are the things that I'm concerned about on the health side. On the voting side, we know that at all the polling stations they only have Spanish and English. What are some initiatives in place, and what are the barriers to make sure that, depending on the location, interpreters of different languages are also available?
So I'm going to try for the question on the health side. Again, our studies are based on something completely new, so we're hoping we'll be sending these studies over and they could make their own policy changes. We were working with Northwell in the beginning of this survey. It didn't follow us through to the end, but we were talking with them about just statistics and data within their within Northwell. So we had started those conversations. So after this is done, we will be giving them the reports, and then it's really up to our advocacy, your advocacy, to push them towards that goal. And Sharon, do you want to add anything to that?
Well, yeah, regarding Northwell, I don't want to shill for Northwell. I don't work for Northwell, even though they do occasionally write a check for something that we do. Hopefully they'll write checks for things you do. And they did step up with our initial framing of this. I chaired a committee at Northwell, which was in existence for about 10 years, that was created specifically to reach out to understand diverse communities. So there was an interest there, I can't say whether it was from the heart, but they realized that their mission was to save lives and further the quality of lives, and they couldn't do that if they couldn't communicate, and it was an understanding of that. What they're doing specifically in terms of making, I don't know, interpreters available, I don't know. But you know, one of the points, I speak to a lot of business groups, and one of the points I make when I go over, I speak to a lot of business groups, and one of the points I try to make to them is that reaching out to understanding diverse communities is not just a nice thing to do, but in a region where fairly soon more than half the population will be non-white, where some of the more prosperous and growing communities are not white in the conventional sense of the word. It's not only a nice thing to do, but it's a smart thing to do. And any business that does not show respect for you in whatever ways makes them appealing to you is going to lose. They're going to go out of business. So that's, you know, and I think a lot of businesses and a lot of organizations, certainly political people, have sort of gotten that. They just don't always understand how to do it. And they need your help again.
Thank you. And the question on voting, again, it's the same thing. It's our job to show these findings and hope that there is going to be policy change and advocate for that policy change. There are a few questions. I'm going to take the questions and then we're going to go on to the next segment.
Thanks, Tara. Hi, my name is Cheryl Kashner. I work at the Empire Justice Center and coordinate the Long Island Language Advocates Coalition, which has been working for many years to advance language access for our communities who may not read, write, speak, or understand English proficiently on Long Island. And I really commend you, Farah, and all of ERA for this amazing research. It's so necessary and really echoes a lot of what we found over the years. I did notice there was not a question, or did not appear to be a question, related to immigration status and whether that interfered with people's ability or willingness to access services. I'm also wondering if there's any breakdown regarding where they encounter barriers in terms of the schools, in terms of the police, you know, what villages, communities, or counties, and sorry, I have a lot of questions. And also just wanted to encourage that we work together towards not only language access, but language justice, where people have the opportunity to have a say in their in the policies that are affecting their lives and their children's lives. So thank you so much.
So again, thank you so much, Cheryl. There was a question on whether they were a citizen and not a citizen, correct? So we did have one question on that. It did not deter people. Majority of the people did say they were citizens or they were green card holders. In terms of some of the other questions you asked, and the main survey, when we publish it and put it on the website, you'll see the questions, and a lot of those questions, those demographic questions were asked on the survey. We just wanted to put, just like a small, small scope of what we've done today.
Hi, good morning. My name is Megan Ra, and I'm here as a partner at a law firm that services thousands of small business owners throughout New York City and Nassau County, and I'm here with my partner, Jenny Kim. I just want to make an observation on one of the charts that was shown through the professor with the beard when you were speaking. It's the usage of the interpreters, and I noticed, because it popped out right away, that the highest percentage of usage of interpreters were situations that actually compels a non-English speakers to engage interpretation services. For example, emergency health, or there's a fire, or you have to call the police, your child is getting expelled from school and you're called to the school. These things will force the non-English speaking parents or families to engage interpretation services. But if you notice, for use of government services, it's pretty low in that chart, and that shocked me and Jenny very much, because we had helped many businesses located in New York City use government services, such as Commercial Lease Assistance Program, which dealt with the aftermath of COVID and all the rent arrears and such. And a lot of non-English speakers are involved in running small businesses. So I was thinking right away, oh, how interesting it is that when it comes to engaging or looking into obtaining government services or looking into it, and those are not, urgent, fire, or calling 911, or calling an ambulance. It's more planning, it's preventing, or it's researching. I find that our clients, and certainly your survey shows that as well, that non-English speakers are not actively seeking interpretation services to look into government services, and there's a lot of government services that are out there for them. So hopefully whatever work you have been doing will propel that sort of change.
Thank you, Megan. I think there was one more question, and then we're going to, or observation, and then we're going to go to the next segment.
Hi, thank you so much, Farah, for presenting this incredibly meaningful data. I'm here as a sixth-year doctoral student in sociology from CUNY. I'm also an adjunct lecturer locally at Adelphi in sociology, so my area of interest is immigrant incorporation, specifically the Asian American community and Muslim Americans. And until now, I've never seen substantive data in suburban areas. It's always been urban-centric, so to be able to see this data presented so meaningfully and methodologically soundly is really, really meaningful for me. The slide on discrimination, if you don't mind pulling it up, the one variable of religion had the highest incidence of always. And I was just curious how much of that was entangled with the visibility of religion for some of our participants, whether it be through hijab or through the racialization of religion for our South Asian participants, and how much of their feelings of discrimination with regards to their race or their ethnicity was entangled with that ability to communicate / the accent, like understanding that that is a process of the racialization of immigration, and I was hoping that Professor Nee could speak to that.
I think that's a great question, and it's also one that occurred to us as we were looking at the data. I think I will say, although the survey didn't go in depth on that question, there was certainly a difference when we compared South Asian respondents to East Asian respondents. It was the rates of discrimination based upon religion were higher for the South Asian respondents. I think that this is one of those areas where the focus group work and the survey work, the research process is iterative, and this is obviously not going to be the end of the road when it comes to investigating these phenomena. And I think that AIR, hopefully in cooperation with NCSS, moving forward in future research projects, that's exactly the type of question we would want to examine.
So in 2022, our first research project, I'll just add to that, we discussed anti-Asian hate. And when we were doing that project, it was on a national scale. On that project that we were working on, it showed very clearly there were certain South Asian communities that were extremely high in terms of discrimination based on religion. So when we were just studying and focusing on that, it did show that. This data, as Chris mentioned, was more, both of the communities are together. I'm sure when we split it up and do South Asian versus East Asian, you can see a difference. Even if we maybe just do Pakistani versus something else, you could see maybe a higher spike. So we will present that data. We'll have it in the report. But for our purposes now, we wanted to do the entire Pan-Asian American population. But when we desegregate that data, you will probably see those shifts the same way you saw on the 2022 research that we've done. And now, without further ado, we will move to the next portion of the program. And if you do have questions, you can meet with the professor with the beard and Dr. Reed, and Larry is there to give you the information also, and myself. And again, it's going to be on our website, so you will get all of the information, and we can also email it to you.